Good morning, students. Welcome back to Pharmacology Made Simple. In today's class, we will be discussing about the adverse drug reactions and drug interactions. WHO has defined an adverse drug reaction as any response to a drug that is noxious and unintended and that occurs at doses used in man for prophylaxis, diagnosis, or therapy. So what is it defined as? Any response to a drug that is noxious, that causes a vomiting feeling, and unintended, that occurs at high doses, which are actually used for prophylaxis, diagnosis, or therapy. Next, we see drug intolerance. Drug intolerance is the inability of a person to tolerate a drug and is unpredictable. Patients show exaggerated response to even small doses of the drug. Example, vestibular dysfunction after a single dose of streptomycin may be seen in some patients. Intolerance could also be qualitative, that is idiosyncrasy, and allergic reactions. Next, we see idiosyncrasy. Idiosyncrasy is a genetically determined abnormal reaction to a drug. Remember, it is a genetically determined abnormal reaction to a drug. Example, primaquine and sulfonamides induce hemolysis in patients with G6PD deficiency. Some patients show excitement with barbiturates. In addition, some responses like chloramphenicol induced agranulocytosis, where no definite genetic background is known, are also induced under idiosyncrasy. In some cases, the person may be highly sensitive even to low doses of a drug. Example, a single dose of quinine can produce synchronism in some or highly insensitive to high doses of the drug. Here is an image of idiosyncrasy. The drug will cause the changes in the genetic factors, and the environmental factors also can play a role on it. And there could be a adverse drug effects such as the hepatotoxicity or the liver failure. Okay, so here in the image we can see that IDR means idiosyncratic drug reaction, which has caused the hepatotoxicity or liver failure because of the genetic changes which has happened. Next, we move on to allergic reactions. Allergic reactions to drugs are immunologically mediated reactions which are not related to the therapeutic effects of the drug. The drug or its metabolite acts as an antigen to induce antibody formation. Subsequent exposure to the drug may result in allergic reactions. The manifestations of allergy are seen mainly on the target organs, that is the skin, respiratory tract, gastrointestinal tract, blood, and blood vessels. So here in the image, we can see that skin rash is one of the allergic reactions which has happened to the patient because of the multiple drug allergy syndrome. Next, we move on to the types of allergic reactions and their mechanisms. Drugs can induce both types of allergic reactions, that is, humoral and cell-mediated immunity. Mechanisms involved in type 1, type 2, and type 3 are humoral, while type 4 is by cell-mediated immunity. Here we see the image of the types of hypersensitive reactions. In the type 1, it is IgE mediated, and the onset is within 1 hour, and what happens is an anaphylactic reaction. Whereas in type 2, it is mediated by IgG or IgM, cytotoxic, and it occurs within hours to days and the result could be the hemolytic anemia. Whereas in type 3, it is mediated by immune complex mediated. It might take up to 1 to 3 weeks. The result is serum sickness. And in type 4, it is mediated by T cell mediated, and it will take days to weeks, and the examples are rashes and Stevens-Johnson syndrome. Okay, so we'll see in detail. Type 1 is also known as the anaphylactic reaction. The drug induces the synthesis of IgE antibodies, which are fixed to the mast cells. On subsequent exposure, the antigen-antibody complexes cause degranulation of mast cells, releasing the mediators of inflammation such as histamine, leukotrienes, prostaglandins, and platelet activating factor. These are responsible for the characteristic signs and symptoms of anaphylaxis such as bronchospasm, laryngeal edema, and hypotension, which could be fatal. Okay, so what are the signs and symptoms of anaphylactic reactions? Bronchospasm, laryngeal edema, and hypotension. Allergy develops within minutes, and it is called as immediate hypersensitivity reaction. So the anaphylactic reaction is also known as immediate hypersensitivity reaction because it occurs within minutes. Example, penicillins. Skin tests may predict this type of reactions. Penicillins, cephalosporins, lignocaine, procaine, iron dextran, and streptomycin are some drugs known to cause the anaphylactic reaction. Type 2 reactions are known as cytolytic reactions. The drugs bind to a protein, and together they act as antigens and induce the formation of antibodies. The antigen-antibody complexes activate the complement system, resulting in cytolysis, causing the thrombocytopenia, agranulocytis, and aplastic anemia. Okay, so what will happen? They will activate the complement system and they will result in cytolysis, causing the death or decrease of those cells. Therefore, there is thrombocytopenia, agranulocytosis, and aplastic anemia can happen because of the destruction of the white blood cells, the granulocytes, or the red blood cells. Examples are carbamazepine, phenytoin, sulfonamides, and phenylbutazone. Mismatched blood transfusion reactions are also cytolytic reactions. Next, we move on to type 3 reaction. Type 3 reaction is known as Arthurs reactions. The antigen binds to circulating antibodies and the complexes are deposited on the vessel walls where it initiates the inflammatory response resulting in vasculitis, that is, inflammation of the blood vessels. Okay, so here what is happening? The antigen will bind to the circulating antibodies and it will form complexes which will get deposited on the vessel walls, thus creating an inflammatory response. Rashes, fever, arthralgia, lymphadenopathy, serum sickness, and Stevens-Johnson syndrome are some of the manifestations of Arthurs type reactions. Serum sickness is characterized by fever, arthritis, nephritis, edema, and skin reactions. Penicillins, sulfonamides, phenytoin, streptomycin, and heparin can cause the serum sickness. Okay, so you came to know what are the reactions of what is serum sickness. It is a reaction which is characterized by fever, arthritis, nephritis, edema, and skin rashes. And the drugs which can cause the serum sickness are penicillins, sulfonamides, phenytoin, streptomycin, and heparin. Stevens-Johnson syndrome is characterized by severe bullous erythema multiforme, particularly in the mucous membranes with fever and malaise. So what happens in Stevens-Johnson syndrome? There is the severe bullous erythema as well as in the mucous membranes there could be a swelling, and there will be the fever and malaise. Toxic epidermal necrolysis is the most serious form of drug allergy. Okay, so what is the most serious form of drug allergy? Toxic epidermal necrolysis with cutaneous reactions can be fatal. Aminopenicillins, sulfonamides, and phenylbutazone are the drugs associated with Stephen-Johnson syndrome and toxic epidermal necrolysis. Type 4 reactions are also known as delayed hypersensitivity reactions and are mediated by T lymphocytes and macrophages. The antigen reacts with receptors on T lymphocytes, which produce lymphokines, leading to a local allergic reaction. Example, contact dermatitis in nurses and doctors handling penicillins and local anesthetics. Okay, so type 4 reaction is also known as the delayed hypersensitivity reactions and are mediated by the T lymphocytes and macrophages. Next, we move on to drug dependence. Drugs that influence the behavior and mood are often misused to obtain pleasurable effects. Repeated use of such drugs result in dependence. Several words like drug abuse, addiction, and dependence are used confusingly. Drug dependence is a state of compulsive use of drugs in spite of the knowledge of the risks associated with its use. It is also referred to as drug addiction. Dependence could be psychological or physical dependence. Psychological dependence is compulsive drug-seeking behavior to obtain its pleasurable effects, example, cigarette smoking. So many people who get addicted to the drugs or are drug dependent always need help or seek for help. The physical dependence is said to be present when withdrawal of the drug produces adverse symptoms. The body undergoes physiological changes to adapt itself to the continued presence of the drug in the body. Stopping the drug results in withdrawal syndrome. The symptoms of withdrawal syndrome are disturbing and the person then craves for the drug. Example, alcohol, opioids, and barbiturates. Mild degree of physical dependence is seen in people who drink too much of coffee. The important questions that could be asked from this topic are: define the adverse drug reactions, explain the 4 types of hypersensitivity drug reactions, which could be asked for 10 marks, and drug intolerance for 2 marks, idiosyncrasy for 2 marks, and drug dependence for 2 marks. Hope this topic is clear to you, students. If you like my video, please do subscribe and share with your friends. Thank you.